Welcome back to Gentle Giants Q&A. So now we're talking about hormones. This is a common theme that so many people have questions about, and so many people think they know everything about it, yet this is not their specialty. Anyway, so questions that I get asked: does hormone therapy cause cancer? No, it doesn't. That is also a myth that people talk about all the time, is being on hormones. Actually, it can lower your chances of having cancer because you're optimal. Because a lot of people who have low testosterone, all these other issues with hormone deficiencies such as thyroid and low estrogen, you can see it more prevalent in those demographic of people, but actually being optimal can actually lower your chances. So that's just a myth, man. And that's why people are so scared of it, because of that simple fact. But when you do hormone replacement therapy, not abuse, it won't cause cancer, and the side effect profile is slim to none. So there's a very big difference between abuse and therapy. Is it only for women, older women, who need hormone therapy? No, because there's people that I've seen that are in their 20s that need hormone therapy. And in my personal opinion, y'all can argue with the wall, I don't care. But even with putting younger women on a extremely low dose of testosterone, it isn't better for them than using actual birth control that causes them anxiety, depression, acne, all these things that they don't need. So my thing is, with birth control, okay, I get it, you're not getting pregnant, but all of the other symptoms of your quality lifestyle that you're giving up not to get pregnant is crazy to me. So, and also you can be not in menopause and be on testosterone. You can be in menopause and be on testosterone. So it's for everyone, because it is a hormone that we naturally have in our bodies, but it starts to decrease over time. As you get older, it decreases even faster if you're overweight, if you don't sleep well, if you're stressed. There's so much more to it than just being, overweight. There's a lot of different reasons why people have low testosterone. It could be someone who's overweight, and it could be someone who overtrains. They all can have the same type of deficiency in their hormones. If you take hormones, you grow facial hair or gain weight. For women, no. So you're on a low dose, which means guys can be anywhere between 10 to 15 times more as far as what their treatment is than women, okay? But if you had a history of hair growth before, then we just make sure your dose is low, but enough so that you have symptom improvement. Normally people gain weight because of the lack of testosterone, having a low estrogen, not the other way around. Can you take over-the-counter hormone creams from Amazon? I mean, you can, but at the same time, creams are only 45% effective. And you don't want to get that on your partner, and next thing you know, you see the guy over here PMSing, right? Nobody got time for that. So you can't have two people over here crying. But anyway, no, creams are not effective. I'd rather give someone a troche, which goes into the bloodstream under your tongue, or the injectable version. We also do pellets as well, but the troche and the injections are my two favorites for treatment.